Welcome back. Governor Kathy Hochul's state budget for 2026 includes funding for a ban on smartphones in school. The governor believes students will be safer and healthier without the distraction of scrolling.
And we can all agree that phones can be distracting, but can they really be unhealthy for our kids? Joining us now to discuss that is Dr. John Cohen. He began his career as a vascular surgeon and is now the CEO of Talkspace, a city-based behavioral health provider. Dr. Cohen, thanks so much for being here. I've been waiting in anticipation to ask you this question because very rarely do you get to ask about this decision by the governor and the broader movement to somebody who actually works with kids and hears from the kids we're talking about. It's easy for us to say, yeah, ban phones. Right. But the work that you've done in New York City with teenagers and the fact that your organization is in favor of removing phones, are those two things connected?
So first, thank you for this morning. And it's a really great question. So I just want to tee up what the issue is for a second. If you look now, the average amount of time kids spend on the phone is 8 hours a day on social media. A third of kids are on it constantly, like all day long. The results are basically, incredibly poor. 45% real anxiety, 40% feel like they're hopeless, 70% complain of unbelievable loneliness, and there's a two times increase in suicide ideation among teens as a result. And if you just look at social media, we forget to look at the other disadvantages of phones. People recruiting them, dangerous challenges, asking them to do incredibly dangerous things, pornography, sex content, cyberbullying, and there's probably another 30 issues that are negative relative to having a phone. So that's the background of where we are. So in TeenSpace, which is the program you mentioned and gives us the results and things that we've seen with the kids. So TeenSpace provides mental health support through a licensed therapist to make it available to 465,000 teenagers in New York City between the age of 13 and 17. We now have close to 27,000 kids on the platform, which has been extraordinary, 70% improvement. But what we're seeing is huge degrees of high anxiety, huge amount of depression. 25% roughly have suicide ideation. And body image is a big one. Relationships are a big one in terms of both family and of course friends. So that's the background of our. So your question is our view of it. First off, hugely supportive of the cell phone ban for for the reasons you mentioned and for others. The teens that we have access mental health through their phones, either by texting, messaging, or by live video. So they use their smartphones to access true healthcare delivery relative to mental health. What's interesting is after 4 o'clock on Thursdays is our most common time. And most of the times they're accessing it is after school and on weekends because they do have 24 access to a therapist. So we believe strongly, and quite honestly, to me, it's a shout out and kudos to the governor for actually putting the ban in place, because it absolutely increases the ability to teach. It increases social relationships between kids. It increases community activities, and it increases communication skills between kids.
So in our final minute here, unfortunately, we're running out of time, but what would you say to parents who, it's difficult to take these devices away from their particularly teenage children. There's going to be an adjustment period for them.
So everybody's fighting this. So a couple of things. There are some really interesting apps that they could put on their phone to, one, protect content. Two, you could also limit the amount of hours with a certain app on the phone. The other is, which is really critical, is to really watch what they're doing. You really need to monitor what they're doing on their phones. And the big one is to provide what we call a timeout. Okay, for the next 6 hours, you can't use your phone. Go do something else and actually commit to it. It's tough for parents to do, but the impact is if they don't do it, social media addiction is more threatening to children than cigarette smoking right now.
The data is clear on it.
The data is very clear on it.
That's unbelievable. Well, thank you. I wish we had more time, but thank you so much for joining us, Dr. Cohen.
Thank you.
Really
My pleasure.
appreciate your expertise in this space.
Thank you for having us on.
Of course.
We'll be right back.